What happens to your body when your liver is failing? Your nails, skin, and even your breath can warn about liver disease. You might feel completely fine, yet your body is already sending signals. Liver disease often announces itself on the surface, long before pain appears. So, let me walk you through 12 visible signs your liver may be struggling. As we walk through them, remember this video cannot replace professional medical advice. Your liver is a huge chemical factory quietly working beneath your right ribs. It transforms nutrients, stores energy, filters toxins, and shapes hormones affecting mood and metabolism. It makes bile for digestion and proteins that keep fluid inside your bloodstream. It also activates vitamin D and helps keep your bones strong and resilient. When this organ weakens, pressure rises, chemistry changes, and the outside appearance follows. Start by looking carefully at your fingernails, because they track illness over time. Some people develop pale horizontal white bands running across several nails on both hands. These bands sit in the nail bed, not in the hard plate. When you press the nail, the lines fade, then slowly return afterward. As your nail grows, these lines stay fixed, not marching toward the tip. Doctors call them muerki, lines often linked with low albumin and serious illness. Albumin is a protein your liver makes to hold fluid inside blood vessels. When albumin falls, fluid leaks, swelling increases, and nail changes may appear or worsen. Another nail pattern is called terry nails, where most of each nail looks white. Only a narrow, darker band remains near the free tip of each nail. Normally, small blood vessels under your nails create a gentle, healthy pink background color. With terry nails, tissue changes hide vessels, so the nail looks ghostly. If many nails show this pattern, especially without visible lunula half-moons, be concerned. Pale nails alone do not prove liver disease, but they justify proper blood testing. Next, put the backs of your fingers together and examine your index nails. There should be a small diamond-shaped gap where the nail beds meet. If that window disappears and the tips look rounded and bulbous, that is clubbing. Clubbing changes the whole shape of the fingertip over many months or years. Some people inherit clubbing, but new-onset clubbing usually signals significant chronic disease somewhere. Heart failure, lung scarring, and long-standing liver damage are common medical culprits here. Now, move your attention down to your abdomen, where the liver actually sits. Imagine a belly so swollen with fluid that clothing no longer fits comfortably. This tense, stretched abdomen, filled with free fluid, is called ascites by doctors. Scarred liver tissue blocks normal blood flow from intestines through the portal vein. When that pathway narrows, pressure upstream rises like squeezing a hose with pliers. Fluid then seeps out of congested vessels and collects inside your abdominal cavity. People with ascites often feel heavy, breathless, and full after very small meals. Doctors sometimes use a needle to drain liters of straw-colored fluid for relief. Even before ascites, you might notice unusual bulging veins around your belly button. These twisting veins radiating outward are called caput medusae, a sign of portal hypertension. They appear because blood is rerouting through surface veins when deeper pathways are blocked. The same pressure problem can create enlarged veins inside your esophagus above the stomach. These esophageal varices might bleed massively if a fragile vessel suddenly tears open. You cannot see varices yourself, but endoscopy lets doctors detect and treat them. Turn your hands over now and study the color of your palms carefully. If the fleshy pads near thumb and little finger look intensely red, notice. This pattern, called palmar erythema, creates a blush over the outer palm areas. Interestingly, the very center of the palm often remains relatively pale in comparison. High estrogen levels open small skin vessels and cause this characteristic redness pattern. Your healthy liver normally breaks down estrogen efficiently and keeps levels within a range. When liver function declines, estrogen can build up, and vascular signs like this appear. Pregnancy can also cause palmar erythema, so doctors always consider timing and context. Now scan your upper chest, neck, and face for tiny star-shaped vessels. These little red dots with radiating spokes are called spider angiomas by clinicians. If you press gently on the center, the branches briefly empty and then refill. 1 or 2 spiders can be normal, especially on sun-exposed adult skin. Several new spider clusters, especially near the collarbones or face, suggest hormonal imbalance. In non-pregnant adults, many spider angiomas are associated with liver dysfunction and cirrhosis. Liver disease also slowly steals muscle, even when your scale weight barely changes. Look at the back of your hands, where bones and tendons are obvious. If the spaces between bones look hollow and stringy, that can indicate wasting. Then check your temples above the cheekbones in good natural lighting if possible. Deeply sunken temples often mean your body is burning muscle for energy needs. A failing liver cannot process nutrients effectively, so the body raids its own tissues. While you are looking, notice whether your palms have thick cords or puckered bands. Sometimes the ring or little finger bends inward and refuses to fully straighten. This hand change is called Dupuytren contracture and tightens the tissue under the skin. It can appear from genetics or repetitive work, but also with chronic liver disease. Alcohol-related liver damage shows Dupuytren contracture more often than expected in research studies. Another powerful visible sign comes from your nervous system when toxins reach the brain. Stretch your arms forward, extend wrists, and spread fingers like a stop gesture. Hold that position while someone watches for a few seconds of stillness. In healthy people, the hands remain mostly steady, with only slight physiological tremor. In hepatic encephalopathy, the hands may suddenly drop and jerk back repeatedly. This flapping motion is called asterixis, essentially brief losses of posture corrected instantly. It signals that liver detoxification is failing and brain cells are sensing accumulated toxins. We call this spectrum of confusion and neurologic change hepatic encephalopathy in clinical practice. People experiencing this may feel confused, sleepy, moody, or have difficulty performing simple tasks. Without treatment, hepatic encephalopathy can progress to stupor coma and ultimately death. Sometimes the first thing you notice is actually a smell when someone enters. Advanced liver failure can give the breath a sweet, musty, slightly decomposing aroma. Doctors call this fetor hepaticus, caused by volatile compounds bypassing liver processing. If you notice this persistent odor, along with other signs, seek urgent medical evaluation. Perhaps the most famous visible sign of liver trouble is jaundice itself. Check the whites of your eyes in natural daylight, not under colored bulbs. If they look yellow instead of bright white, bilirubin may be accumulating. Bilirubin forms when red blood cells are broken down and recycled by the body. Your liver usually processes bilirubin and sends it into bile for elimination through stool. When that system fails, bilirubin leaks into skin, eyes, and even other tissues. Urine can turn dark brown like very strong tea, while stool may become pale. Many people with liver disease notice bruising from minor bumps that never bruised before. Tiny red or purple spots called petechiae can appear after slight pressure or scratching. Your liver makes clotting proteins that help blood solidify and stop bleeding after injury. It also produces hormones that instruct bone marrow to create new platelets regularly. In cirrhosis, both clotting factors and platelets may fall, increasing bruising and bleeding risk. An enlarged spleen from portal hypertension can additionally trap platelets and worsen the shortage. All these external clues hint at underlying processes slowly injuring the liver inside. One major driver worldwide is heavy long-term alcohol use beyond moderate guidelines. Alcohol inflames liver cells, then triggers scar tissue that gradually replaces healthy functioning tissue. Another growing cause is metabolic syndrome, with belly fat, high triglycerides, and insulin resistance. Excess sugar and refined starch overload the liver, forcing it to store fat internally. Over years, fatty liver can advance to inflammation, fibrosis, and eventually full cirrhosis. Chronic infections like hepatitis B and hepatitis C can also quietly injure liver cells. Vaccination can protect against hepatitis B and may prevent future cirrhosis development. Modern antiviral treatments can cure many hepatitis C cases and reduce progressive scarring significantly. Despite these therapies, there is no simple medication that reverses advanced cirrhosis completely. That is why noticing early signs and addressing causes is so crucial. If you see several of these changes together, please take them seriously, not dramatically. New or worsening abdominal swelling always deserves timely evaluation by a healthcare professional. Confusion, extreme sleepiness, or a flapping hand tremor are medical emergencies, not curiosities. Persistent dark urine, pale stool, and yellow eyes should never be ignored either. Your doctor will likely order blood tests looking at enzymes, bilirubin, albumin, and clotting. Imaging tests like ultrasound or CT scanning can show liver size, texture, and fluid. Sometimes, endoscopy is needed to check for varices or unexplained internal bleeding sources. The goal of recognizing these signs is not to make you fearful or obsessed. It is to give you a language for what your body shows externally. Many important liver risk factors are modifiable with steady, realistic lifestyle adjustments over time. Limiting alcohol, especially daily heavy drinking, can greatly reduce your lifetime risk of cirrhosis. Choosing more whole foods and fewer sweets reduces fat buildup inside liver cells. Regular physical activity improves insulin sensitivity and can help prevent non-alcoholic fatty liver disease. Vaccination, safe sex, and avoiding needle sharing can reduce viral hepatitis transmission risk significantly. If you already live with liver disease, regular follow-up detects complications much earlier. Medication procedures and lifestyle changes may support better outcomes when problems are caught sooner. Your body is speaking constantly, but most of us never learned its vocabulary. Skin color, nail patterns, swelling, and subtle tremors are phrases in that physical language. Paying attention does not mean panicking. It simply means respecting what you observe. You are not expected to diagnose yourself, only to notice meaningful changes early. When something repeatedly feels off, asking a professional for help shows wisdom. Protecting your liver today also protects your brain, heart, and future energy tomorrow. This organ handles poisons, so your mind can think clearly and body can move. When it fails quietly, every other system eventually feels the consequences of that silence. Remember, your liver rarely shouts. It usually whispers first through small, visible changes. Listening to those whispers gives you a chance to respond before crisis arrives. If this video helped you understand liver warning signs, consider subscribing for more explanations. Sharing this knowledge might help someone notice danger earlier and change their path. Talk with a healthcare professional if you recognized any patterns that worried you today. Bring questions about your nails, abdomen, bruising, or mental clarity to your appointment. Awareness is not fear. It is the first step toward informed, proactive health decisions. Your liver is already working for you every second without demanding attention. The question now is whether you will work for it in return.